The case today that we're discussing is John Hancock, and he's a 56-year-old male. The date of evaluation is October 8th, 1793. Location is Hancock Manor, Beacon Hill, Boston, Massachusetts. Chief complaint, recurring excruciating joint pain and swelling, with the acute chief complaint of stupor and dyspnea. Patient's a 56-year-old male, currently governor of Massachusetts with a significant 20-year history of debilitating polyarticular joint pain, traditionally diagnosed by his physicians as podagra. The patient had experienced progressive systemic decline over the last decade, culminating in severe generalized weakness and an inability to ambulate, along with failure to perform his normal duties of governor. On the morning of his death, the patient was in his usual state of poor health with no novel or new complaints. At approximately 7 a.m., he experienced a sudden acute onset of severe dyspnea. There was no mention of chest pain, jaw pain, left arm pain. He had chronic swelling of the lower extremities, but this was not noted to be any worse the day of the event. There was no mention if the swelling was asymmetrical. He had been experiencing severe headaches, and his physicians were summoned at approximately 7 a.m. to find him in a near comatose state. They provided some palliative measures. However, these were unsuccessful, and the patient was pronounced dead less than 60 minutes later after the acute onset of his symptoms.